Hello and welcome to everybody. I am Kathy Olewski with the Vasculitis Foundation, and today we are featuring a video for Heart Awareness Month, since February is Heart Awareness Month. And it's a very interesting special roundtable discussion because the heart can be one of the organs affected by vasculitis. Typically, cardio involvement is associated with Takayasu's vasculitis, but it can be found in PAN, MPA, EGPA, and Behçet's. So we've brought together today 3 patients, all of whom have had some direct or maybe indirect issues involving their heart, to help us raise awareness about this issue during Heart Awareness Month. So before we meet our guests, I'd like to share with you a short video clip from one of our recent webinars. This clip is Dr. Ken Warrington, and he gives a brief overview about large vessel vasculitis and how it can impact the arteries associated with the heart.
So when we think about giant cell arteritis and Takayasu arteritis, as I mentioned, we're referring to a form of large vessel vasculitis because they both affect the largest blood vessel in the body, which is the aorta, shown here, and that's the artery that's coming right out of the heart and then gives off branches that go to the head and neck and branches that go to the arms. And this area here, these blood vessels, are the ones that are most commonly affected in GCA and Takayasu. So you can see or start to understand these blood vessels are supplying the head, where of course there are very important structures, right, like the brain, the eyes, and also the arms. And so when we have blood vessel inflammation here, we said inflammation will lead to thickening, which leads to narrowing and can lead to interruption of blood flow. So this interruption of blood flow is going to affect then the organs that we just talked about that are mainly in the head and in the arms and sometimes other areas in the body. So what we're looking for in large vessel vasculitis, whether it's GCA or Takayasu, is we're trying to see, is there narrowing in the blood vessel? So this is an example of an angiogram where a catheter is introduced in the artery, there's dye that's injected in the blood vessel, and we're seeing that the blood vessel is more normal here, but then here there's an area that's tapered, that's narrowed, and of course is limiting blood flow. So these tests are very helpful at showing us, is there narrowing in the blood vessel? But we also want to know, could this be just a cholesterol plaque, which we see in folks who have high cholesterol, perhaps diabetes, high blood pressure, smoking, and so forth. But we're looking to see, is this a cholesterol blockage, or is this a vasculitis type of narrowing or blockage? And so CT scan and MRI are very helpful because then if we take a slice across this blood vessel, we can look at the wall of the blood vessel. So this is an example of the aorta, again, the largest blood vessel in the body. And this is the aorta here when it's starting to leave the heart. And this is the aorta here in the back of the chest. You can see that the aorta here, you actually cannot see the wall of the aorta because it's so thin that it almost is not visible on scans. But look at the difference of the wall of the aorta here. There is a tremendous amount of swelling and thickening, which is the vasculitis. So that's what we're looking at in this patient. So we know that this is not a piece of cholesterol blocking or thickening the blood vessel, but it is this swelling that's going all around the blood vessel, causing inflammation and damage to the artery. Similarly, again, this is normal, this is abnormal, so it's this thickening and swelling that we're looking at. This would be an example of an MRI scan showing that there's enhancement, meaning it's bright, it looks white, and that relates to inflammation and thickening, and that inflammation gives us an idea that there still is ongoing inflammation from the vasculitis, and we need to treat that and bring that inflammation down.
And thank you to Dr. Warrington for that important information. Also, if you're watching this video from the Vasculitis Foundation's website, We'll include links under this video that provide more information about cardio involvement and vasculitis.